Our test patient is already opened up in PowerChart. As you can see, it is ZZZ KTW CPOE 1. And on the banner bar, I can confirm that I'm in the right encounter, which is an inpatient encounter on the far right, where my hand cursor is. It says the admitted date is March 28th. And today I want to show you what a medication order looks like for a patient using CPOE as an order entry system. This patient's chart under the inpatient workflow, I'm in the chief complaint, and you can see this patient is a 54-year-old female that was admitted for dysuria and flank pain. I think this patient has a urinary tract infection and or a pyelonephritis, so I actually want to go and order an antibiotic for this patient. I can use my new order entry, so when I click on it on the left-hand side, there's a search here where I can search for orders, and I will search for ciprofloxacin, and it gives me a number of choices, and I want to actually use IV ciprofloxacin, and the dosing that I'm interested in is 400 milligrams IV intermittent every 24 hours for 7 days. So if I want to select this order and order it, I click on it. And when I click on it, on the far right, there is a green icon that appears and my orders for signature inbox. When I click on this orders for signature basket, I can again see my full order here. I actually want to modify it and say why I'm ordering it. So I will go under modify details and it will open up a new window. And as you can see, there's a blue mark, which tells me that I need to actually complete this order. There are missing details that are mandatory. So when I click on the order itself, a bottom window pops up and it'll tell me the yellow fields are mandatory and says antibiotic indication. In this case, I want to type UTI, and I'm going to say it's UTI with pyelonephritis. I can double check and make sure that it's 400 milligrams intermittent injection, frequency is Q24, and the start date is essentially now. And I will sign the order. And to confirm my order is placed, I can go under my order profile window, and I can see that the medication, ciprofloxacin, has been ordered under status.
I'm Kim Fletcher. I'm logged into PowerChart. I'm logged in as a nurse. You can see here, this is what we call Care Compass, and it's the landing page for the nurses. You can see details about your patients, their room numbers, their name, reason for admission, the provider, any kinds of plans of care that are in place. Up here in my right-hand corner, you can see my little yellow starburst. It has a 1 beside it. You can also see the starburst right here next to my patient's name. This is the alert to the nurse that there are new orders or results that need to be viewed. I can actually review them by clicking here, or I can come up here to this starburst and review here. So I click on that. I can see that my patient here has got 1 new order. When I open that up, I can see the actual order that was written. It is ciprofloxacin. It was ordered by Dr. Sid. It gives me the time. It tells me the dose, that is IV intermittent, that it's for a UTI. The nurse review, the expectation is that when the nurse is looking at this order, that they're reviewing it to make sure it makes sense, that there's no concerns that they have. If there are concerns, they would close this down and then give the provider a call to review those concerns. But if there's nothing that's alarming to them, what they do is come over here in the right-hand corner and they click Mark as reviewed. Once that happens, you can see that little starburst has gone off the patient's chart in that upper top corner there and over here. When you click on the patient, I'm going to go into the actual patient's chart. I just want to have show everybody what it looks like when you're actually on the MAR sheet. So I'm just going to bring that over here, and you can see this is actually the patient's record. When I click on the MAR, I can now see that ciprofloxacin is on my medication admin record to be given. You can see right above the ciprofloxacin that there is a little mortar and pestle sign, and this is the visual alert that the medication still has yet to be verified by pharmacy. When we first were looking at the order on Care Compass, I did a nurse review. If I hadn't completed it on Care Compass and I had waited and maybe came to the MAR to do it, this here, these little eyeglass sign, that's my visual cue that this medication had yet to be reviewed by the nurse. So the next thing that would happen is that pharmacy is going to do their verification.
Hi, my name's Nelson Pierce. For the purpose of this demo, I will be playing the pharmacist. So what you can see on my screen here right now is the pharmacy patient monitor, and this will display patients with unverified orders. So these are orders that will need to be reviewed by pharmacy. For this purpose of this demo, we are looking at this patient here with CPOE 1. If I select the patient, I can see the medication that is sitting unverified, the new order to review. I will then click process. And this will bring me to the pharmacy, to the medication manager. And this is the pharmacy module where pharmacy orders will be reviewed and verified. So this is the action of verify has been pre-selected in my action column against the new medication order. If I move down over here, I'll be able to click apply, and this will apply the action. In this case, there were a few different products that would potentially be able to fill this order. So it's bringing me to the product selection menu. And this is a menu where I'm just ensuring the correct product is being assigned to this product. So I can see the order details up here. It's ciprofloxacin 400. And I have a list of products down here. There's just one for this one that might potentially match. This is the correct product I want to assign. So I'm going to say move over. The product's assigned, and I'm going to continue on to the next stage. Once the product is assigned, I now can review all the clinical details of the order. So this includes the order details up top, but as well as the route, frequency, any rate information for this is an IV medication, the ordering physician, any additional order comments or notes that might be added, as well as the area it's being dispensed from and doses being sent up. There's also this comments box over here is highlighted, and this is where additional order comments may appear. In this case, it was highlighted because an antibiotic indication was entered for this order. Once after finishing the review, I can click OK, and this is going to be the stage of verifying the order. Now you can see there's two arrows pointing to the left. That means there's an outstanding action against this order. This will be applied once I click submit. After I've clicked submit, the order verification is complete.
Welcome back. I'm Kim, and I'm logged in again as a nurse, and we're just trying to demonstrate what happens when the pharmacy does their verification. If everybody remembers, when we first looked at the ciprofloxacin here on the MAR, there was a mortar and pestle icon that is now gone away. And the medication has been verified by pharmacy and reviewed by the nursing, and we could go ahead and